Chapter 3: The Role of the Therapist and Client in CBT. Cognitive behavioral therapy, CBT, is a collaborative and active process that relies heavily on the roles and responsibilities of both the therapist and the client. The therapeutic relationship, goal setting, and the principle of collaborative empiricism are central to the effectiveness of CBT. Additionally, the importance of homework and practice cannot be overstated in facilitating lasting change. In this chapter, we will explore these key components in depth. The therapeutic relationship in CBT. 1. The nature of the therapeutic relationship. Unlike some other therapeutic approaches that focus extensively on the therapeutic relationship itself, CBT emphasizes a structured, goal-oriented relationship between the therapist and the client. However, this does not mean that the therapeutic relationship is any less important. In fact, a strong, collaborative, and trusting relationship is essential for successful CBT outcomes. The therapist in CBT often takes on the role of a coach or guide, helping the client navigate their thoughts, emotions, and behaviors. The relationship is characterized by collaboration. The therapist and client work together as a team, with the client actively participating in their treatment. Respect. The therapist respects the client's experiences and perspectives, creating a safe space for exploration and change. Empathy. The therapist demonstrates understanding and compassion for the client's struggles, which fosters trust and openness. 2. Establishing trust and rapport. Building trust and rapport is the foundation of the therapeutic relationship in CBT. Without a strong rapport, clients may be less willing to engage in the challenging work of identifying and changing deeply held beliefs and behaviors. Strategies to build trust and rapport. Active listening. The therapist listens attentively, reflecting back what the client says to ensure understanding and validation. Non-judgmental stance. The therapist creates a non-judgmental environment where the client feels safe to express their thoughts and feelings. Transparency. The therapist is open about the goals and methods of CBT, ensuring that the client understands and agrees with the treatment process. 3. The balance between empathy and structure. CBT therapists must strike a balance between being empathetic and providing the structure needed to achieve therapeutic goals. While empathy is crucial for building a strong therapeutic alliance, the structured nature of CBT ensures that the therapy remains focused and goal-directed. Empathy helps the client feel understood and supported, which is crucial for motivation and engagement. Structure keeps the therapy on track, ensuring that sessions are productive and focused on achieving specific outcomes. Goal setting in CBT. 1. The importance of goal setting. Goal setting is a critical component of CBT, as it provides direction and purpose to the therapy. Goals help both the therapist and the client stay focused and motivated, and they provide measurable benchmarks for progress. In CBT, goals are often set collaboratively and are tailored to the client's specific needs and circumstances. Types of goals in CBT. Short-term goals. These are specific, immediate objectives that can be achieved within a few sessions. For example, identify and challenge automatic thoughts related to social anxiety. Long-term goals. These are broader objectives that may take longer to achieve and often involve more significant behavioral or cognitive change. For example, increase confidence and reduce avoidance behaviors in social situations. 2. The SMART criteria for goal setting. CBT goals are often set using the SMART criteria, which ensures that goals are clear, realistic, and achievable. SMART goals are specific. The goal should be clear and well-defined. For example, reduce panic attacks is vague, whereas practice deep breathing techniques during moments of anxiety is specific. Measurable. The goal should have criteria for measuring progress. For example, reduce the number of panic attacks from 5 per week to 2 per week. Achievable. The goal should be realistic given the client's current situation and resources. For example, attend 1 social event per week may be achievable, while become the life of the party may not be. Relevant. The goal should be aligned with the client's overall objectives and values. For example, a goal related to improving work performance may be relevant for someone with work-related stress. Time-bound. The goal should have a specific time frame. For example, reduce the frequency of negative automatic thoughts within the next month.
3. Revisiting and revising goals.
As therapy progresses, it is essential to revisit and, if necessary, revise the goals. Sometimes, clients achieve their goals more quickly than anticipated, or new issues may arise that require a shift in focus. Regularly reviewing goals helps keep the therapy dynamic and responsive to the client's evolving needs. Collaborative empiricism, working together. 1. The concept of collaborative empiricism. Collaborative empiricism is a fundamental principle of CBT that emphasizes the joint efforts of the therapist and client in exploring and testing the client's thoughts and beliefs. This process is empirical, meaning it is based on evidence and observation, much like a scientific experiment. Key elements of collaborative empiricism. Joint exploration. The therapist and client work together to identify and examine the client's thoughts, beliefs, and behaviors. Hypothesis testing. Together, they develop hypotheses about the client's thoughts and test these hypotheses through various cognitive and behavioral experiments. Evidence-based. The conclusions drawn during therapy are based on evidence gathered from these experiments and observations. 2. The role of the therapist. In collaborative empiricism, the therapist acts as a guide and facilitator, helping the client explore their cognitive processes and encouraging them to test the validity of their thoughts and beliefs. The therapist's role includes providing psychoeducation, educating the client about the cognitive model and how their thoughts influence their emotions and behaviors, guiding cognitive restructuring, helping the client challenge and reframe distorted thoughts, facilitating behavioral experiments, assisting the client in designing and carrying out experiments to test their beliefs in real-life situations. 3. The role of the client. The client's role in collaborative empiricism is active and engaged. They are not passive recipients of therapy but active participants in the therapeutic process. The client is responsible for self-monitoring, keeping track of their thoughts, emotions, and behaviors between sessions. Participating in experiments, actively engaging in behavioral experiments and reflecting on the outcomes. Providing feedback, offering feedback on what is working and what is not, helping to refine the therapeutic process. The importance of homework and practice. 1. The role of homework in CBT. Homework is a critical component of CBT and is integral to the success of the therapy. Homework assignments are designed to reinforce the work done in sessions and to help clients apply the skills they are learning to their everyday lives. The purpose of homework is to promote continuous learning and practice, which is essential for creating lasting change. Types of homework assignments. Self-monitoring. Clients may be asked to keep a thought diary, recording automatic thoughts, emotions, and behaviors that occur between sessions. Behavioral experiments. Clients may be asked to engage in specific activities that challenge their beliefs or test new behaviors. Skill practice. Clients may practice specific CBT techniques, such as relaxation exercises, cognitive restructuring, or problem-solving strategies. 2. The benefits of homework. Homework in CBT offers several benefits. Skill reinforcement. Homework helps clients reinforce the skills they learn in therapy by applying them in real-world situations. Increased self-awareness. Through self-monitoring, clients gain greater awareness of their thought patterns and how these thoughts influence their emotions and behaviors. Empowerment. Homework encourages clients to take an active role in their therapy, fostering a sense of empowerment and control over their mental health. 3. Overcoming challenges with homework. While homework is essential, some clients may find it challenging to complete assignments. Therapists can help by clarifying expectations, ensuring that the client understands the purpose and importance of the homework, addressing barriers, discussing any obstacles that might prevent the client from completing homework, such as time constraints or lack of motivation, and finding solutions together, offering support, providing encouragement and reinforcement to help the client stay motivated and engaged in the process. 4. The role of practice in creating lasting change. Practice is crucial in CBT because it helps clients internalize new ways of thinking and behaving. The more clients practice the skills they learn in therapy, the more likely they are to create lasting changes in their thoughts, emotions, and behaviors. Examples of practice. Regular use of cognitive restructuring. Clients practice identifying and challenging distorted thoughts regularly, making this process second nature. Mindfulness practice. Clients incorporate mindfulness exercises into their daily routine, helping them stay present and reduce automatic reactions. Behavioral activation. Clients consistently engage in activities that align with their values and goals, even when they don't feel motivated to do so.